Hello. Okay, this question is about chronic hamstring tightness. And no matter the amount of stretching, no matter the amount of dynamic exercise, dynamic stretching, static stretching, it's just always tight. There's quite a few factors that kind of play into this. So let's start with the possibility of previous injury. So a lot of times when I see something that is chronically tight, especially in athletes and hamstrings, let's just stay on the topic of hamstrings. A lot of times I address that as something that a lot of times is the body's response to trying to prevent injury. So if there's something that has ever happened in that area, let's talk like a track runner, something that's running track, doing sprints, and you've had something that has caused a hamstring strain, you've done something, even a rupture. I know it's extreme, but I've seen it. So something of that nature, the body's number one reaction is to always protect itself. That's relevant with degeneration, with arthritis, all of those things. The idea is the body is trying to grow more space, more bones, more fluid, all of those things to protect the area. So in this case, a lot of times when I see chronic tightness, especially in the hamstrings, it is the brain's way of saying, I will not re-injure. So what it's doing, it is not allowing all of those fibers, those super quick, super fast muscle fibers, to work throughout your regular day, okay? So what it's doing is just protecting itself. So it's staying really tight, really tense. We can say thank you to the body for wanting to do that, but it's not very helpful when we're wanting to become more limber. So what I want to do to help move forward with that is, number one thing that I think is super duper important, not because I'm a chiropractor, but because anatomically it makes sense. So if you have a hamstring that inserts right at the very base of that pelvis, the number one thing is make sure that the pelvis is functioning properly. That way you're going to take some tension off of the muscle coming straight out and going all the way down to the back of those knees. Make sure that we have proper alignment so that you can cross that off the list. So if there's still problems, now we can focus on the actual muscle. So one of the really great things, dynamic stretching, static stretching, where you're kind of sitting and holding, you're doing the hamstring, you're bringing the leg out and you're touching your toes, all that kind of stuff, that's great. It's, it does what it needs to do, but a lot of times it's not stressing the muscle enough to get it to kind of calm down. So I'm a huge fan of doing foam rollers, of using muscle rollers, hand rollers, to where you can even put it up underneath your hamstring and roll those out before your exercise. That way when you go to do your exercise where you're contracting that muscle again, that body's responding, telling you, I'm not going to get injured, I'm going to stay really tight and cranky. Then you can use that foam roller afterwards, get it loosened up a little bit. That's a really good start for doing things like in a response, okay? So get adjusted, make sure that hip is doing well. Another thing that you have to always think about is also not just from the hips, but let's talk about like from the feet up. So if we have super flat feet, our heels our arches turn inward, which if you can stand and do that, you already feel tightness right up underneath your butt here, because that's the insertion of that hamstring. So we also have to address all the way down to the floor. So if you're someone who has really, really shallow arches, maybe it's something that we need to consider getting an arch support, bring that arch up and take some tension and stress off of those hamstrings, okay? I know that's kind of a lot, but it is one big machine. So if we work from the floor up, let's address that. So another thing is if you have really high arches, okay, you're going to feel that on the outside along those glutes and even deep on the inside on this gracilis. So let's look at the feet. Let's address that. Let's see if we need some insert support or if we even need to work and strengthen the inside of these legs to pull that arch down a little bit, okay? And if you need to send me a picture of what the inside of that foot looks like, we can start there too. But let's treat this as a big machine, and let's do that. Then we can do static stretching, those are fine, but then let's do foam rolling, muscle rolling, and then giving our body some grace, okay? If we're in a position where you have had some sort of traumatic hamstring injury, some sort of even quad injury, you know, wherever your problem is, if you've had something in the past, be thankful for our bodies and knowing that they are doing the best that it can to protect it so that this does not happen again. So if we need to slow down on the amount of reps, if we're doing good mornings, you know, if we're doing good mornings and we are just feeling a really tight tug either in our glutes or in the back of that, maybe we don't need to go as deep, okay? Let's tuck that belly button in and let's just apply a little bit of stress to it without making the body freak out and stay tense and really tight. So take it a little bit of a time, kind of assess your situation, and please message me one-on-one if you have something super specific that maybe I touched on here but maybe didn't go into enough depth for you. So just let me know with that, okay? This is there's a lot of scenarios with that. So please just let me know if I addressed your question. If not, please reach out.